Well, sinus pain and pressure impact millions of people. It's such a common problem that ear, nose, and throat doctors and surgeons, they see it so much that they are now creating a special day to talk about it.
Yeah, how about that? Tomorrow, in fact, is World Sinus Health Awareness Day. So Dr. Gautam Desai with Kansas City University is joining us live this morning to talk about sinus health. Good morning, Dr. Desai.
Good morning, Pat and Carrie.
All right, cool. So obviously sinuses, it's something that you don't think about until they're giving you a real problem. But there's a lot we don't know about the sinuses and why we should be kind of careful with them, right?
That's correct. I mean, that day is not as exciting as National Taco Day, but if you have trouble breathing, it can certainly make you tired and wear you out.
Well, nobody wants to be worn out. So what would you say causes sinusitis?
Yeah, most of the time they're caused by viral infections, but bacteria can also cause them, and sometimes fungi. As you saw from the weather report, the mold counts were high, which can certainly set those off. But basically, they cause swelling in the sinuses, and then the fluid can't drain, so you get swelling and pressure.
Yeah, and this can be a big deal, because this happened to me a few years ago, Dr. Desai. I thought I was just having allergies that became a cold, and it just weeks went into months, and
It just never ended.
And I finally went to see a doctor, and I had sinusitis and bronchitis, and she said, "You're really sick. You should have come in a lot sooner." I mean, it's not something you should ignore, right?
Yeah, if you have the symptoms, you want to try and catch them at the beginning before that inflammation becomes chronic. So if you have a simple sinus infection, you should try some over-the-counter medicines first. You can try some decongestants, allergy medicines, maybe some acetaminophen, ibuprofen, and then just drinking plenty of fluids and trying to get those sinuses to drain.
What would you say is the main difference between, symptoms from sinusitis as well as just the regular seasonal allergies? Because, I mean, like Pat said, he went on for weeks and almost months before realizing how serious it was.
Yeah, that's a great question because there's so much overlap. You have allergies, you have sinus infections, you have COVID, you have a cold, and a lot of them share the same symptoms. But for sinuses, sometimes you'll have a little bit more pressure in the front of the face, especially if you're leaning forward or bending over. You might notice changing pressure in the front of your face. Whereas with allergies, you might have itchiness of your skin or your eyes. But a lot of them feel pretty much the same, for the first few days, which is okay because the treatment is pretty much the same for the first few days.
And is there any danger, Dr. Desai, like over-treating yourself? Like if you have a Nasacort, spray, and you have the seasonal fall allergies, and you're just every hour or so, giving yourself a little injection there. I mean, should you be careful?
Yeah, that definitely you can get rebound congestion. So if you're using a decongestant spray, what happens is that shrinks the blood vessels temporarily, but after a while it stops being effective, and then your vessels become larger and just remain large and cause that congestion. So if you're using a decongestant spray, you can just use that for a few days, but something like Nasacort or a steroid spray or a saline spray, you can use longer.
And is there anything else we should be trying? I know some of those are simple and you can buy them over the counter, but is there anything else that we could check out?
Yeah, one thing that helps a lot of people is something called a neti pot, where you take some boiled water, distilled water, purified water. You guys gotta make sure it's not tap water because that can be dangerous, but you put it in one side of your nose, let gravity do its magic, and brings out some natural products on the other side of the nose, and you'll be surprised at first what comes out of there. But it definitely
That's one way to put it.
Yeah.
Some natural products, you say?
I've tried it. My kids have. Those are helpful. But yeah, it's a good. It cleans out those pipes. To put it that way.
It sure does.
All right. Thank you, doctor.
Thank you both. Have a great week.
You too.